A lot of you might not have noticed, but here's a fun fact about me. I'm actually blind. Okay, so not that blind, but remotely blind. Like, I think I have, in terms of myopia, 375 and 3.5, or reverse, whichever the case. And I also have astigmatism. And I've had this since, like, I was 8. I'm sick of having people around me that have 20/20 vision and make fun of me. Okay, I'm joking. No, I don't get bullied or anything, but it's just, I just love it when I wear contact lenses because it's like not in my face and stuff like that. This is a big pet peeve of mine, but have any of you gotten tanned with your glasses, like the lines on the sides each summer? Anywho's, your girl finally pulled the trigger. I decided I was getting LASIK this year. That's it. Done. The glasses. Well, actually, no. You will occasionally see me in glasses. I think, considering my line of work, where I'm in front of a computer a lot of hours per day, I will still wear, like, blue light glasses. And so, I'm getting LASIK. It's this week. I booked it last December. And it was just confirmed literally like an hour ago. I just need them to confirm the time. So, but yeah, I'm gonna bring you guys along for this. You're gonna maybe see some parts of the procedure or the like pre-op stuff, like the questions or the like physical assessment at the clinic, and then I'll take you guys along for the post-op. So that's gonna be really fun. And yeah, like, if you guys ever have any questions, drop down in the comment below. But yeah, so cheers. Hey guys, today is surgery day. It is LASIK day. I'm so tired, but it's perfect because then afterwards I get to sleep. I'm supposed to be there for 4 to 5 hours. My appointment's at 11. It is currently 10:35, so we're gonna get going because we're walking there. It's like 17 minutes walk. And yeah, so I'll try to see what I can film, but last day of being blind. Yes. Okay, see you guys soon. So prior to my LASIK appointment, I had an online consultation about a year and a half ago where we discussed if I was a viable candidate for LASIK, the different types of lasers that could be done, their respective prices, and they kept that on file for I believe they keep it on file for two years. And when I called to get my actual appointment for the procedure, they pulled the file, gave me the date, and 48 hours before the actual procedure, they could call and confirm the time. Knowing as well that the procedure in total would last around 4 to 5 hours because the surgery itself takes around 10 minutes for both eyes. However, prior to that, you have to go through 5 to 6 different people in total to do multiple steps. So here is as I walked in, I got my paperwork. So these are the consent form, what the procedures are, the risk and all that you need to sign off on. And it was also sent by email to me prior to the appointment. So it was a quick review. So for the first step, we had met with a technician in a different room where he would explain to me how it's gonna go. So he's explaining that we're starting with 3 different tests, but he had a couple questions beforehand. So the questions were in general like, when's the last time you got your eyes checked? Has your vision been stable? Do you have dry eyes in general when you're wearing glasses? Do you wear contact lenses? When's the last time you wore contact lenses? FYI, you have to stop wearing contact lenses, like the soft ones, 12 hours before the procedure, so a little FYI there. And also when you're wearing contact lenses, are your eyes extremely dry? Do you get headaches, etc.? Then he walks you through the 3 machines. So the first one is just he's checking the general health of your eyes. Then the second one, I believe, was taking pictures. Those pictures are going to be very useful for the next technician to kind of like tell you what is the best treatment for your eyes and your case depending on your eye health. And the last machine is the same concept, like it's to take pictures of your eyes, but specifically for the surgery room. So these pictures from the last machine would go in the surgery room for the surgeon to kind of like use and see how to proceed with the operation later on. So they do this even before like you've seen any other technician that checked your eye health, just in case you do end up getting the procedure that day. So if you watched this far, that means you have glasses and you're interested in LASIK. So the next 2 steps are actually 2 different eye exams. I emphasize on different because they're done by different people to ensure that you have the right prescription diagnosed by 2 different people. So this prescription is then given to the surgeon. So this is why they have 2 different people do this to double check the numbers.
Tomorrow morning, I'll see you back to make sure that vision is within normal. We know it's going to still be a bit blurry. We want to make sure there's no wrinkles on the cornea, no infection or inflammation. If there's an intervention needed right away, we will have to make you wait so that we do something about it. Okay? But otherwise, you should be.
It's 24 hours later for the follow-up checkup. I'll fill you guys in for what happened yesterday. But we have a checkup today, and honestly, I see very well. I see better than Mark right now. And yeah, when they give the all clear, I can start taking off the glasses indoors. But yeah, we'll keep you guys updated. There's like a bit of blood, I think, on one of my eyes.
Yeah, that's normal. Yeah, okay. You can see essentially what it is. It's bruise. Okay. So probably during the surgery when they put the instrument, we're trying to squeeze your eyes. Okay. Oops. And then it just leaves a mark, but it's like bruising over your body, so it will leave with that time. Okay. When you're ready, you can start. Perfect. Everything looks all good. Okay, you're all set. You can start wearing glasses outside again for 2 days. I just see dryness in the eye right now. Okay, so that just might be, it's cold outside or just a small reaction from the surgery itself to put some drops in your eye so that just gets resolved. Okay.
Hi guys. So it's been more than 24 hours since my procedure. We are Sunday morning, and I just wanted to come up and kind of like explain the rest of the LASIK procedure, since I wasn't able to film like inside the last 2 steps of the procedure. So obviously the last 2 steps were basically going in, talking with a technician about like, okay, what were the selection I ended up choosing. So I chose LASIK custom technology. Then she was like, okay, so these are the consent forms you gotta sign. Ran me through those, and then talked about payments and stuff like that, so the finance stuff, got all that settled. And then she explained to me the post-op instructions. So post-op instructions, like they give you papers and all that. So like for me, like I have, considering what I chose in terms of like laser, this is specific to this one. So like if you end up doing a different technology, you might have an extra step, one less, or like different medication and stuff like that. So I had 3 drops that I would have to use for around 5 days that are mandatory, and then the rest of the time would be just hydration drops for a while until like the dryness kind of like subsides. So she was explaining to me like how I would have to use them, what I need to go get. Some of my drops were prescribed from the surgeon itself, so I had to go get that afterwards. And then they also explained that you would have a 24-hour follow-up. So the following morning, which was yesterday morning, I went for the follow-up, which is a regular eye exam to see like how's your vision doing the next 24-hour. And then they will call you in 2 weeks to have a phone call follow-up as well. So that's kind of like what she was running through with me. And she also explained to me like within the first 24 hours, you're not allowed to do this, meaning you're not allowed to do much actually. So I wasn't allowed to watch anything. I wasn't allowed to read anything. So digital screens, reading, or using my eyes for much. I couldn't shower. Thank God I showered in the morning. Don't rub your eyes, don't squint. Keep your glasses on for 24 hours, including sleeping that first night. Obviously, no alcohol, smoking, no driving. And for myself as well, I had asked to have a pill for a relaxant, just because she explained that like the procedure could be like, you could be nervous. So I was like, you know what, can I just have the relaxant? It's quite easy. And they're like, of course. So I didn't feel the relaxant much before, but I felt a little bit more calm. So I was like, you know what, let's go ahead and do it. So the procedure itself, you go in, the surgeon meets with you and he explains to you. So like he has the pictures that you've taken from the first test, and he explains like, hey, so these are what I see. You don't have any problem. Like for myself, he was like, I don't see any problem. It should be an easy procedure, max 10 minutes. So he was explaining to me like, what we're gonna do is like put something on your eye so it keeps it open, and then while we start the procedure, there was a point in time you're gonna see black. Like it's gonna be as if you close your eyes. Do not panic. It is absolutely normal. Then we're gonna do the laser. You're gonna start seeing again afterwards. We're gonna close the flap, and then we're gonna make sure it's closed properly, and then that's done for one eye. We do the next eye. So they do give you the heads up that you're gonna see black for like a couple seconds, and he genuinely meant a couple seconds, and it genuinely felt like I just closed my eyes. Not except I knew my eyes was not closed. And then so he explained that. He was like, here, I'm giving you the relaxant pill, and then you walk back out while he preps the room and stuff like that. And while they're waiting for the relaxants to start like taking effect as well, they also numb your eyes. They have numbing drops. The guy outside, the assistant, he was able to give me 2 doses of it, so 2 drops in each eye. And then once I felt like kind of relaxed enough, I went back in. So they explained to me, you just lay down on this like bed procedure, and under the bed is basically under the laser machine. And he's not alone in there. He has 2 other people kind of like helping out with the machines and stuff like that. And then they put something under your legs, and they ask you if you want a squeezing ball for stress. And I was like, I think I'm okay. So then they get right at it. Like it's a very quick procedure, guys. It's like 10 minutes max, 5 minutes each eye. So they'll tape your lashes up, your lashes down to make sure that doesn't get in the way. And then they put this like metal piece to kind of keep your eye open. And then they go right ahead. Like they just start the procedure. I unfortunately flinched a little bit because I saw something come towards my eye. Absolutely normal reaction. That's why I have a little bruise in my eye. It's gonna go away in a couple days. It's like any other bruise, so it's because I flinched. So he ended up adding more numbing drops into my eyes, and then I felt nothing. And then they did that for one night. They did that for the second night. I got up afterwards. I could see, but the feeling is like you could see as if I had my contact lenses on, but I just came out of the pool. So like I just came out of water, so it's still blurry. Right away they make you sit on the side where they have like these like a eye check machine, and he checks right away. He's like, okay, looks all good, you can go. So you go out, they give you the first dosage of like the drops that you're supposed to drop in your eyes, and then they send you home. In all honesty, that relaxant actually hit me more afterwards, where I ended up sleeping the entire night. Mark ended up just waking me at every 2 hour and every hour for my drops that were prescribed. But yeah, so that's pretty much the entire procedure. It was very seamless, honestly. Like I got out and I was just like, okay, now I go home. And then the next morning when I did the follow-up, I walked there again, and I was just amazed. I could see stuff further along the walk than Mark. And I did the test in the morning, and she's like, yep, so your eyes are good. It's a bit dry, like it's normal after the procedure, but keep doing your drops and you'll be fine. If anything, like she's like, just for fun, can you read these further than this? So I was able to read 2 extra lines, which were under the 2020, like further than the 2020 vision. So my eyesight is actually pretty good now. So yeah, for in terms of like what's left is I'll get that call in 2 weeks, and I just need to keep doing the drops until, you know, Tuesday. The prescribed drops, and then after the prescribed drops are done, I just need to do the hydration drops just to make sure they're not dry. But yeah, it's amazing. Like, I just see perfectly, and I would highly recommend it. It's like a life-changing thing, especially when you're young and you like, there is a chance of regression. They did explain that to me, and this percentage is different for everyone. So mine was 20%, but I ended up choosing the plan for a lifetime. So that means that whenever I do have a regression or anything like that, as long as I've been showing up to every follow-up appointment with LASIK MD, they would just fix it up for me. So that's really nice. That's an extra cost, but yeah, in total, I'm paying, I think, for both eyes, LASIK custom plus the lifetime, I paid $4,290. And the lifetime is $200 per eye. So if you didn't use the lifetime, mine is $400 from that total. But I think it's worth it because, again, like, I'm quite young. There's a chance of regression just as I grow older. So they'll just fix it when that occurs. And yeah, so that's pretty much it. I hope you guys enjoyed this and find it informative, but I'll talk to you guys next time. Bye!